My name is Ryan Duffy, and this is to be watched in conjunction with my term project for the USF College of Public Health, Dr. Marie Moujwa. My project is on antibiotic resistance for high school students. On slide 1, we're going to go over the antibiotic resistance, and the fact that is the resistance of bacteria to an antibiotic that was originally an effective treatment against it. These have been coined the term superbug. How does antibiotic resistance relate to environmental and occupational health? Well, resistant bacteria become an environmental hazard because of the effectiveness of standard treatment protocols, allowing the infection to persist and increase the risk of spread to others. An example of the superbugs include methicillin-resistant Staphylococcus aureus, vancomycin-resistant Enterococcus, or VRE, vancomycin-resistant Staphylococcus aureus, and extensive drug-resistant tuberculosis. On slide 5, we have a picture of MRSA infection, typical MRSA infection. Slide 8 is a picture of the MRSA, VRSA bacteria itself. Slide 7 is a picture of the vancomycin-resistant Enterococcus bacteria. Slide 8 is a picture of the extensively drug-resistant tuberculosis bacteria. On slide 9, we talk about how this happens. Antibiotic resistance has been exacerbated internationally by the increasing availability of antibiotics globally since the 1950s and development of penicillin. Also, the uncontrolled sale in second and third world countries, where these antibiotics can actually be sold over the counter without first obtaining a prescription from a physician, as well as the prescribing of broad-spectrum antibiotics by physicians. And next, slide 10 is, so this only happens in other countries, right? Unfortunately, no. Although non-prescription use accounts for 19 to 100% of antibiotic use outside Europe and Northern America, according to the Lancet Infectious Diseases Commission, the United States by far has the most misuse of antibiotics, such as not finishing the standard dose, stopping them when symptom stops, sharing unfinished medication, which unfortunately creates 2 partial doses instead of just 1 partial dose, essentially doubling the risk of antibiotic resistance to 2 separate people. And also patient pressure on physicians to prescribe antibiotics even if they're diagnosed with a virus, oftentimes to prevent possible litigation. What's the worst that could happen? According to the World Health Organization, treatment failures due to resistance to treatments of last resort for gonorrhea have now been reported from 10 countries. Gonorrhea may soon become untreatable as no vaccines or new drugs are in development, according to the World Health Organization. How much does this cost? Not really how much does it cost, but what does it cost? It obviously increases the cost of healthcare, and first of all, they become resistant to the first-line drugs, the cheap drugs. So more expensive, broad-spectrum antibiotics are required to be used, other therapies and whatnot. It increases hospital stays because of, number 1, our first issue, and it also increases an economical burden on working families due to their breadwinners being in the hospital. Slide 13. What can I do to prevent the future inevitable takeover of the superbug overlords? The CDC has 4 recommendations. Talk with your healthcare provider about antibiotic resistance for 1. Do not take an antibiotic for a viral infection like a cold or the flu. Do not save some of your antibiotic for the next time you get sick. Take an antibiotic exactly as the healthcare provider tells you. Do not take antibiotics prescribed for someone else. End of story. What can physicians do? Well, they can prescribe beneficial antibiotic therapy when likely. Only prescribe antibiotic therapy when likely to be beneficial to the patient. Use an agent targeting the likely pathogens
Also, use the antibiotic for the appropriate dose and duration. Making sure that patients know this. It's a very big deal. What else can doctors do? Well, the Infectious Disease Society of America has proposed the 10 by 20 initiative, which essentially calls for the development of 10 new, safe, and efficacious systemically given antibiotics by 2020. So 10 brand new antibiotics that are safe, new, and effective by 2020. Now it's time for our activity. Slide 17 has the materials list. First of all, you're going to need a large group of kids, plenty of room, preferably a gymnasium, scissors, and 5 different colors of paper cut into 5 different pills, first of all, and then thin sheets of paper to be given out randomly to the students. The procedure on slide 18 goes on. Pretty much it's a play on Duck Duck Goose. The group of the teenagers, aside from 5 volunteers, will be sitting in a circle. And these 5 volunteers will each have an individual color of pills. They'll each have a different color. While the students sitting down will have random sheets of paper. Now, the students with the pills can only tap on the shoulders of someone whose colors do not correspond. So the student with the blue pill can't touch the shoulders of the student with the blue paper, and so on and so forth. So it goes on in the usual Duck Duck Goose fashion. Say a student with a blue pill can touch a student with a red piece of paper. Boom. He runs around. If the student with the red piece of paper sits down before the blue wins in usual Duck Duck Goose fashion, then the student with the red paper becomes immune to that antibiotic. He would then be given a blue piece of paper. Therefore, he's not going to be chosen again by the same kid, which kind of gives a visual representation of how easily the phenomenon occurs of antibiotic resistance. In conclusion, superbugs are not to be messed with. MRSA, VRE, VRSA, multi-drug resistant tuberculosis, all are deadly. It's expensive. These are very expensive drugs to treat. People need to take their antibiotics appropriately. They need to talk to their doctor about antibiotic resistance, and do not be afraid to speak up for yourself. When at the doctor's office, ask questions. Be sure you're having the appropriate treatment. The end.